Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast. Can I start with your name, please?
Lawrie Hooper, member of the House Keys for Ramsey. And I think I've recently described it as the largest assault on NHS care the island has ever seen, and I stand by that. That mandate is a horrific reduction in service level for the people of the island.
What are some of the most concerning parts of it?
I don't even know where to start with that. I mean, there are so many areas in that mandate, but essentially the document seems to be saying we're not going to treat people. That's what it boils down to. So one example of that is early doors in the mandate. One of the objectives that the department has set is that waiting times at A&E won't get any worse. They're not going to get better, so you can throw that out the window, but they're not going to get worse. That's their aim for the year. It's quite a low bar. When you read further into the document, though, Manx Care acknowledge that they may not be able to achieve that because when you delay treating patients, there is a good chance those patients will then need to be treated in the emergency department. And that's in there in black and white. Read it for yourself. It's in that document that says, I'm really sorry, but we're not going to treat people. We're going to delay treatment, which means they might get so ill that they need to go to A&E, and that's going to affect our A&E wait times. And that's just the first thing that jumps out at you from that document. There are statements in there around, we accept that children's services are not currently meeting the need, but we're not going to do anything about it this year. And you look at that document and just think, this is mind-blowing, that this is an absolute admission of failure. They've decided we're not doing an adult ADHD treatment pathway this year. We might revoke the dedicated ME long COVID service that we spent years putting together. It is an unbelievable document. And the reason I resigned from my post back in October was because I was really worried that this was the direction we were going in. And I was hoping beyond hope that by resigning and standing up and calling it out, that it would have an effect on government and they would shift their direction of travel. And it is very clear that that hasn't happened, that they have doubled down on service cuts, and it is just awful.
So you mentioned, this is one of the reasons why you resigned, because you were hoping they wouldn't go down this road. So you were aware that some of these were in the pipeline, or some of these discussions, or, if you could see the direction, what have you done to try and change it?
So I wasn't aware that a lot of this was even on the table. And that's part of the problem, is the stuff that I knew about wasn't this. This is worse than I was expecting. So one of the statements that I remember making when I resigned was I was worried the Chief Minister was intending to privatise parts of our health service, and he was adamant that wasn't going to happen. He was quite angry about it, actually. But now we have a document in front of us that says quite clearly we are going to reduce NHS services. It says that in black and white. And we're going to expand private options. We're going to push people towards private. That's privatisation. That's what privatising a service means. You're going to stop doing it on the NHS, but start telling people, but don't worry, you can pay for it over here. That's privatising the health service. And that's what this mandate says. In black and white, they are aiming to do. I do not even know where to begin with some of this stuff. And Alexa, I've only seen this document in the middle of the sitting this week, so I only saw it as it was published on the Register of Business. I haven't really had time to go through it with a fine-tooth comb, but the stuff that I've seen on a first read through, it has really worried me. Beyond worry, I am terrified by some of this stuff.
From what you've been saying, the way that you've been speaking, even your body language, you can see that you are very passionate about this. As a former minister, what do you make of it?
It's difficult to say. I mean, there were a lot of options open to the Council of Ministers about how you deal with this issue. No one is saying that the health service is perfect, right? There is a lot to be done around efficiency and making sure that we're spending money wisely and that we get a grip on the budgets. That is categorically needed. But there are ways of doing that. And bringing down the guillotine on services and saying, no, actually, we're just going to stop things, that is not the right way of doing it. And my worry with this is, even when you look at the stuff that's in there that is bad, that is all predicated on them still being able to come in on this budget. But they've got the budget numbers wrong. In the document itself, the amount of money they're saying they're going to spend is more than we approved in the budget in February. And you look at that and go, well, hold on, how does that work? They've got a savings figure in there that's 2% of the budget. The savings figure is 15 million. We know now that actually it's going to be 20 million is the overspend this year, not 15. So you need to add another 5 on. So actually the savings they need are 20 million. Now, forgive me if I'm wrong here, but 20 million is not 2% of 360 million. It's 5 and a bit percent. So they can't even use a calculator. They can't even add up. And that's terrifying, because what they're essentially doing is stripping all of these services back. They're putting a pause, calling a hold on all sorts of things that they've started work on that isn't going to happen now. And they've openly saying it's not going to happen this year, and some stuff is only going to happen subject to funding. So one of the things that's in there is vaccination programs. They're saying actually there's loads of changes that need to happen to keep pace with JCVI recommendations, to keep pace with what's needed. But they're only going to do that subject to funding. So actually, what does that even mean? That's not even a we'll do it later. It's just we'll do it if there's money. The whole thing is just built on this kind of shifting sands, this kind of house of cards, which is predicated on them being able to save that absolutely insane amount of money that we all know isn't going to happen. And so you look at it thinking, hold on, they need to make all of these cuts. They need to stop all of these services. They need to stop developing all of these services as well. They're going to push people away from routine treatments and into A&E, again, something they admit in the document. And that's if they can make all these savings. Well, what if they can't? And we all know they can't. I think if you would ask Manx Care, can you deliver £20 million worth of savings this year in this climate, given the pay situation, given inflation and all the rest of it, I think they would turn around and say something like, it's going to be very challenging. But what they mean is no. And so actually, you're starting off with a really bad start point, but it can only get worse. It isn't going to get better than this. And what makes it even worse, to pile on top of all this, is the government have said that we're going to have a discussion on this in March Tynwald. What they've done is they've tabled it for a general debate, not a vote. They're not coming forward and saying, we think this is the right thing for the island and we need you to approve it. What they're saying is, we're doing it and we're going to let you talk about it. They don't even have the confidence to stand up in public and tell people, we are cutting your health services and we think it's the right thing to do. They haven't even said that. They're just going to lay it before Tynwald and let us have our say, and then they're going to walk away knowing that there's not a lot we can do about it because we haven't been given the opportunity to vote on it.
Can I ask, if you were still in the position, what would you have done differently?
That is a complicated question. I have been saying for a very long time that what Manx Care needs is a glide path. You need to agree a multi-year funding settlement that says, this is where you're at, and in 5 years, that's where you're going to be. And you give them 5 years to actually deliver on this change. And then what they need is a government that's going to stand behind them when they have to do things that are difficult. And there are difficult things that need to happen. They need to have difficult conversations about repatriation of services or doctors' pay or whatever it may be. And they need a government that's going to back them instead of publicly haranguing them every single time they try and do something. But we've never had that. We've never had that 5-year commitment from the government. What we've had is year-on-year arguments with the Treasury around funding, and every year they've given less than has been needed. And so what's inevitably happened is they've overspent. Well, they haven't overspent. We told you at the start of the year how much money we'd need. You didn't give it to us, and that's life, because healthcare is a reactive service. What do you want to do? Tell people that rock up at A&E, I'm sorry, I'm not going to treat you because I've run out of money. But that's what they're doing. They're telling people, I'm sorry, I can't send you to the UK for treatment because we can't afford to pay for it. And that is an awful position to be in. And the only people that lose out here are people who are vulnerable and sick and who need treatment and who need help and who need care from the service. And if I'm working in this environment and looking at this, I don't know how I'm going to be explaining some of this to patients. And that is the worst part about all this, is patients on the front end are going to be dealing with health professionals, and health professionals are going to be wanting to treat them and wanting to provide them with the best possible care, and being told by the minister, by government, you're not allowed to do that.
At the start of the interview, you said, the reason why I resigned was because I could see where this was heading. At the time, wouldn't you have been able to do a bit more if you were still in power as a minister, as opposed to resigning and then shouting about it? You can't really. All you're doing now is raising the awareness and raising the alarm bells. But the actual person that has the power is the person in the seat.
So the problem with being a minister in the Council of Ministers is you are one voice, and I raised all of these issues and concerns around that table, and the problem was the support wasn't in the room. The support wasn't there. And so ultimately, it was always going to come down to a decision where council of ministers would have said, you either do this or you resign. That was always going to be the case. And I had hoped, like you said, I hoped that being in the room would give me the influence and the ability to bring them round, but that didn't happen. It wasn't going to happen, and that became very clear to me, actually, and that's ultimately what tipped me over the edge. I really thought I could fight this properly from the inside, but it just wasn't going to happen. And ultimately, democracy is an exercise in collective embarrassment, right? We govern by making sure that people know what's going on and that people can talk to their MHKs and their government and say, this is okay or this is not okay. That's the process. And the problem when you're a minister is you can't really do that. I can't stand up as a minister and say, this is what I think and this is what Comyn think. Because of collective responsibility, you're tied by, you have to support government policy. And I think that was the challenge. And so sometimes if you do want to say, I need to disagree with this, you have to resign. That's the system. And I actually think that's perfectly fair. I don't think it would have been right to have tried to remain as a minister on the inside whilst at the same time actively campaigning against a government policy. That wouldn't have been the right approach. So you kind of have to say at some point, this is a red line that I'm not willing to cross. And for me, the red line that I was not willing to cross was decimation of our health services and privatisation of our health services. And I heard the Chief Minister assuring us this wasn't going to happen. But then equally, we heard the Health Minister assuring us there were no cuts coming. And it turns out that wasn't true either. So it is getting very difficult, I think, to believe anything that they tell us, and especially when they then go ahead and publish documents that directly contradict things that they've already told the public.
I have to play devil's advocate here because you mentioned the Health Minister. We can say, you said, she comes out and she says this, but this is something this is a problem that she inherited. She's not very long in the role now.
No, but she would have walked in knowing the landscape. I mean, I wasn't exactly quiet about the problems they were facing. And she would have had exactly the same decision to make that I did, which was, do I agree with this or not? Now, she has two choices. She either says, yes, I agree with this and I'm willing to be the one that pushes this through, or she says, I'm not willing to do this, and you stand up and say, I'm going to resign. And ultimately, if the government can't find someone who's willing to do this, they would have to change their approach because somebody has to be responsible for it. And if they can't find anyone who wants to be responsible for it, they would have to do something different. You don't have that. You have a minister that has stood up and said, this is the right thing to do. She's put her face on the front of the mandate. She's written a tiny little foreword. And you have that document that essentially, as you've already reported on, is going to be doing things like reducing the level of beds available, reducing service levels that exist on the island. The whole thing is just... it's unbelievable, actually. And this idea that I've only been in post 5 minutes, so it can't possibly be my fault. Well, actually, I can assure you none of this was actually on the cards in October when I resigned. All of this has been developed out since then. This is the Chief Minister's alignment of the mandate and the operating plan. All of this stuff has come out of the woodwork since I left the government because there were no plans to do half of this stuff. Some of it is very new information, even to me, and I consider myself to be quite well informed about this stuff. So there's stuff in there, and there's other things which I've flagged up with a number of third sector organisations as well, because there are statements in there and which will affect the things they're doing. And again, I don't know how much engagement or consultation there has been with those quite key partners, actually. And it is really a worrying situation to be in where the government isn't even bringing something to Tynwald for a discussion and a debate and an approval. They're basically saying, this is a fait accompli, this is what we're doing.
If I can take you back, you said that you've written or you've spoken to some of the third sector partners. Is this following on from this mandate that's been released then?
Yeah, so like I say, there were some things in there which worried me enough to feel I should probably reach out and say, look, have you seen this? Just to raise awareness more than anything else, because there's a lot in there. Like I say, they've talked about they're not proceeding with diabetic retinopathy, they're not proceeding with the adult ADHD pathways, or the children's services. They've already said there's going to be no change. We'll look at maybe doing something in the 2026-27 financial year. It's all in there in black and white, and the problem you've got is because it is such a big document, because it isn't really being tabled for a proper Tynwald debate and a vote, there isn't going to be that much in the way of publicity unless someone starts shouting about it. I mean, you saw the government press release. I'm sure that didn't talk about any of these things. There was nothing in there that said, oh, by the way, we're going to be slowing down routine surgery so much that we're worried it's going to impact on A&E waiting times. It didn't say that in the press release, but it says it in the document. And that's the kind of issue that I've got here is I think the more that I read it, the more that others read it, and people will see things in there that I haven't seen, it's going to raise more and more concerns the more people spend time with those documents and understand what's in them. And that's really why I'm trying to raise some awareness here, because I don't know everything about everything. I don't know what some of the language in there might mean for some of the organisations and some of the services and some of the people out there. But if you are a regular user of one of these services, you might see something in there and go, well, hold on a second, that's That's wrong. That's not the way things are or the way things should be. And so really, as I said in my Facebook post, people really need to see what's in there, read the news articles that have been published about it. That's the Manx Radio and Energy have got some pretty detailed information out there now about what's in there. And if you've got concerns, talk to your MHK and say, look, you need to get to the bottom of this, guys. It's not up to the public to read through every line of this document and understand it. That's our job as MHKs. But they'll only do that if they've got constituents on the phone saying, this is worrying me, I think you need to look into it.
How important is that constituent's voice?
Well, it should be really important. Ultimately, they're the people we work for, right? I'm here in this quite privileged position because the people of Ramsey have put their trust in me. And it is my job to make sure I repay that trust. And every single member of Tynwald is in the same boat. And so if our constituents are saying, this isn't what I signed up for, actually, this isn't okay, we should listen to them. But I'm not aware the government has consulted with people about these service changes or service cuts. I haven't seen any engagement with the public or with service users around any of this stuff. The Manx Care Act, strangely, requires there to be consultation with service users. So interesting to see how they think they've complied with the law on that one. But they haven't talked to anyone. They have simply announced it. They have dropped this bombshell on us and said, despite telling us in no uncertain terms, there are no cuts coming, they are absolutely driving a coach and horses through healthcare on the Isle of Man. And I don't understand how they think they're going to get away with it. I don't understand how they think they can stand up one day and say, we are not privatising healthcare, and then almost in the same breath say, but we are reducing NHS services and pushing you towards private options. I'm at a loss.
By raising awareness, I know you've been doing this since October, you've been speaking out. A lot of people, when we post our stories, a lot of members of the public, they always say, good on you for speaking out, but why now?
Well, like I said before, when you're a minister, you can't speak out about policies you disagree with. You either toe the line or you resign. And so you fight your corner in the room, and some of my ministerial colleagues will definitely confirm that we had some of those fights in the room. But ultimately, you make a decision, and this is the way our politics works. It's all about compromise. How far are you willing to go? And I have supported Comyn policies that I haven't really agreed with, but they haven't been significant enough disagreements for me to think I can't go along with this. But this was a red line for me. It was an absolute no, and I made that very clear to my colleagues and to the Chief Minister that there were things I would not countenance doing as a minister, and at some point you have to say enough is enough, and you have to resign. It is not okay to just go along with things like this because it's a collective responsibility matter, and that worries me as well, because I know I talk about the Health Minister driving this, but ultimately this had to have got through the Council of Ministers. So all of the ministers in that room must feel that this isn't worth resigning over, that this is something they are happy to go along with. And that as well is quite worrying for me, because there are lots of things that you're willing to go along with, but things like this, which the document openly admits is going to cause harm, you think, how can anyone stand up and say, I'm going to go along with this? I don't understand it, and I'm still trying to wrap my head around how you've got all those ministers in that room have all allowed this to get to this stage, to let it get published, and actually to be willing to stand behind some of this stuff that's in here. It's mind-blowing.
Have you tried to reach out to anyone? Question?
What do you mean by anyone?
Put your concerns maybe to the Department of Health.
Well, my worry is I don't think they'll be willing to listen. I've raised a lot of these concerns very publicly over recent months, and they've done workshops that I've been involved in. I managed to miss the last one because I was in fact in A&E, funnily enough. So in those rooms, I have made my concerns abundantly clear about some of these things, and we've had some pretty firm discussions around these things. But like I say, it's quite clear that nothing has been taken on board, and it worries me really that some of these decisions are being made, and it's purely around cost. It's actually, are we going to do these things? No. What's going to be the impact on patients? Oh, actually, the service is going to be worse, and that's what the document says. Not in a nutshell, in black and white. It is screaming out of that document that things are not going to get better. The only commitment that they've made around some of these things is we'll try not to make things any worse. And even so, Manx Care have stood up and said, well, good luck with that. It's, like I say, I'm at a loss. I'm not very often lost for words, but with something of this scale for government to try and just almost sneak it through, last sitting of the year, just table it, let's have a discussion, but no actual vote, and not really engage with anyone. I've not heard anyone from the government turn around and start talking about this in public. I've not heard interviews from the minister. I've not seen anyone from government stand up and say this is what we're doing and why we're doing it. I've seen a small press release, which is, like I say, already financially illiterate, some of the numbers in there. And it's just mind-blowing.
By doing this interview and encouraging people to read the document and speak to their MHKs, what are you hoping can be achieved from all of this?
Well, ultimately, I think Tynwald is going to have to make a decision on this, one way or the other. And that's the right thing to do. And I might not like that decision when it's made, but ultimately Tynwald has to make a decision. It shouldn't just be up to a few members of the government. Tynwald should be the ones to decide. And if Tynwald members are going to make that decision, they need to be fully informed. They don't just need the government spin. They need to hear from their constituents about what their constituents want and believe, what level of service our constituents want us to be fighting for. And we need to understand what the impact of some of these decisions is going to be on our constituents. And that's kind of the point. So when this is debated in Tynwald, when there is a vote on this, which there will be a vote on this, I can assure you of that, whether the government wants it or not, we will be voting on this. And if that happens, when that happens, I think Tynwald members need to make sure they're going into that debate fully informed as to what this really means, not just for the island's finances, but actually for people. And we lose sight of that, actually, that it's people that we're here to represent. And if I've got a choice between spending money or spending lives, you spend the money, right? That's what it boils down to. That's my view. Others may disagree. Others may say, no, actually, money is more important. And that's fine. I will disagree with you on that, but that's democracy. But if we're going to have a proper democratic debate and a democratic decision on this, all the facts need to be out there. Nothing should be hidden. And everyone needs to know what this means for healthcare on the island, because this isn't something that you can undo. The moment you start moving away from a national health service to a privatised system where we are giving people private choices instead of offering them an NHS service, you are going to end up with that being very difficult to undo, if not impossible. And the people that lose out are the people that can least afford to pay. And that is absolutely wrong. Healthcare is not something that should depend on your ability to fund it. Healthcare should be something that is available to everybody who needs it. That is the way the NHS should work. That is the way the NHS does work. And they do a fantastic job with what they have. And again, they're not perfect. No one is saying they are. Everyone knows things need to change. But drastically cutting services, stopping treating patients is absolutely not the way to do it.
Have you had any feedback from your own constituents?
Well, seeing as this was published on Tuesday, I don't think they've had much chance to engage with it, but seeing as I posted some stuff on social media, I have started to get emails and text messages and social media messages from people who are all, I think, quite rightly concerned, and I have started following some of the debate on social media, on some of the posts from Manx Radio and Energy and others, and again, it feels very much like the level of outrage out there is justifiable, if I'm honest. I'm not seeing lots of support out there from people for some of the things that are being suggested here in this document, some of the things that are being required of Manx Care. And ultimately, like I say, this is all about having a full public conversation, an open conversation with the public about the way things are. I'm expecting that I will get lots of contact from people now following, interviews and conversations and things. I have a political surgery coming up. I'm expecting there to be people there talking about this. But I would be very surprised if I get a groundswell of opinion from people coming forward saying, no, actually, this is the right thing to be doing. This is the right approach. By and large, I find that people on the island are very supportive of the core principle of a national health service, of making sure that healthcare is provided to people free at the point of need, that we aren't charging people, we aren't pushing them into private care, and that, generally speaking, I think everybody wants Manx Care to do better. Everybody has different views on what that might look like, but I don't think I've ever had a conversation with anyone that turns around and they've told me we should stop treating people. I don't think I've ever had anyone make that suggestion to me, but that is exactly what this document quite honestly calls out and says they're going to start doing.
What is your view on the future of Manx Care?
Well, ultimately, I think you're at a crossroads here. You've either got a decision where we do believe that we should have a publicly funded health service that is free at the point of use, by and large. And if so, how do we structure that? How do we run it? I think Manx Care get a lot of bad press, if I'm honest. But by and large, I think they are trying to do the right thing, and I think they are doing the right thing, by and large. Again, they're not perfect, and we could talk for hours about the things I think they need to change. But I think they do quite well for what they have. The problem that you have is actually it's politicians. It's politicians refusing to actually listen and refusing to understand some of the challenges that are being faced, and instead going in with their kind of predetermined, well, I know that's the problem. And I'll give you an example. We were in a briefing quite recently where, again, Manx Care were being harangued about things like their administration and management costs. And only to be told by one of the improvement directors who's come from the UK, who's seen these things, goes, there's just no truth to that. No truth to it at all. The organisation, compared to any organisation in the UK, is lean. So, but actually, that's worrying, because then you look at the mandate. There's still a requirement in there to shave £500,000 off their already lean management and administration costs, and you think, okay, in principle that sounds great, but what does that actually mean for patients? Well, what it means is if you're already running on a threadbare service, does that mean longer turnaround times for things like letters, referrals, appointments? Yeah, probably does, actually. And that's where I think we're falling down here, because we never talk about the impact on patients. What we talk about, and if you read the document, it talks about this extensively, about this target or that target, or it's going to affect the budget in this way. It doesn't turn around and say, and this is the experience people are going to have on the ground. Are things going to get better for people, or are things going to get worse for people? And ultimately, by reading through it, it's very clear that things are not going to get better over the next 12 months. The next 12 months is going to be extremely difficult for anyone who needs to access healthcare. And there's a sort of a hope in the document that says, but don't worry, next year will be better. And there's only so many times you can be told that before you start to wonder, is that really the case? And especially when the people that are telling you that are the same people that have told you things like, we're not going to privatise services, we're not going to cut services, I didn't know this was going on. Hold on a second. Actually, we know that those things aren't true. And so you've been caught out already telling us things that aren't true or aren't entirely true. And now you're telling us, but don't worry, you can trust me when I say this is going to happen, things are going to get better. Well, I don't think I do anymore. I don't think I can trust people who have been found to have told us things that turn out not to be true. And that's a problem. I think you have to have trust in ministers, in MHKs, to be able to do this job. And the moment you say, I can't trust anything that you tell me, it makes doing this job very, very difficult. And actually it makes trying to get to the bottom of anything very, very difficult. Because if you've got the public out there saying the same thing, telling you, actually, I don't believe a word they say, and you do hear that from constituents quite a lot, actually, how can you effectively govern? How can you effectively do the things that need to be done? How can you make the difficult decisions that need to be made when you've already lost the confidence of the public? It becomes an impossible position, and to be honest, I think the government need to think very long and hard about that, about how this particular government is able to continue functioning when even the most recent social attitude survey shows people have absolutely lost confidence in the Council of Ministers.
I think my last question, and I'm going to put it very loosely. Earlier you spoke about, please correct me if I'm wrong, right? So this is the picture that I kind of painted in my head listening to you speak when you spoke about Council of Ministers and, because you're in a certain position, you have to go along with the yes instead of having the fight, or you can have the fight, but you still have to go along with whatever you're expected to. That's my understanding hearing you. And then you also spoke about how you can't understand why other members voted for this or approved this. Very loosely, are you trying to say, or are you? I know I'm phrasing this wrong, but should people have a backbone and stand up?
I get what you're saying, but in essence, that's what it boils down to. I mean, being a minister is quite difficult. It's you have more than one job, really, because you are a minister for a department, but you're also a minister in a broader sense. And so you do have a fight in the room, you will. And some of those can be quite amicable, and very rarely does the Council of Ministers actually vote on something, because by and large, you talk about things, you kind of reach a consensus, and you kind of move through. But there are occasions where you do have a vote, and the Chief Minister will say, look, I need you to vote on this. And even that isn't black and white, because there have been occasions that I'm aware of where a majority of ministers have voted to agree with something, and the minister responsible has said, okay, I know we've just about got this through, but it doesn't feel like I should progress with this because it's only a razor thin in here, and I don't want to put you through that. And that, so it is quite a collegiate environment. But after that decision is made, after you've had that fight in the room, the decision is made, and then you are required to either support it or resign. That's the rules. And, okay, you can play fast and loose with that, and other ministers have in the past. Mr. Thomas is a great example of this, where you agree something in the room, you may not agree with it, and then subsequently you carry on opposing it, and then you end up getting fired, because that's the Chief Minister's, it's his right then to say, no, you've broken the rules, he can fire you. He doesn't have to, of course. He may turn around and say, you've broken the rules, but I'll let it slide. It's up to him. But essentially, yes, you make a choice then. Do I toe the line, or do I say, no, I'm not supporting this, I will resign over it? And yes, so it is ultimately up to the individual minister to decide where any particular decision sits on their own kind of moral, ethical framework, and whether, like you say, does that mean they should have a bit of a backbone? Well, I think ministers probably should, and they should say, I don't support this. And again, it's about balance, because you wouldn't want that happening on every issue. You couldn't govern if ministers were resigning left, right and centre. But something like this, that is going to affect 85,000 people, that is quite fundamental, I think, to the way the Isle of Man functions, I would have thought that this was of a seriousness that says, yeah, I'm either in or I'm out on this. And that hasn't happened yet. Maybe it will. Maybe I'm judging too harshly on this one. But it is quite surprising, I think, that this has got to the stage it's got to, with the ministers that we have not standing up and saying, I'm not willing to support this serious degradation in services. And so that has been quite surprising for me. I was expecting to see some service cuts. I was expecting to see a retrenchment. I was expecting to see some things put on hold. I was expecting to see some what you would term difficult decisions have been made. I was expecting all of that. What I wasn't expecting it to be this bad. And I think that's what shocked me the most about reading that document. I wasn't expecting it to be as catastrophic as this seems to be. And that's why I'm a little bit concerned, actually, that we haven't had ministers already turn around and say, I can't, even quietly, I can't support this, I'm just going to quietly bow out. That hasn't happened. So, yeah, it is an interesting situation that we're in. And obviously it is an interesting time, I suppose, if you are a minister, do you support this or not? There is a little voice in the back of my head that says maybe they don't really know what this means. Maybe they haven't read all of the document. Maybe they haven't really understood it. Maybe they've been briefed and they've kind of listened and understood what they've been told, but maybe they haven't had the opportunity to go through this in the level of detail that maybe I would have expected. Who knows? I can't second guess or try and judge the way that they've acted. I don't think that's fair, really, at this stage. But like I say, I'm very surprised that we're where we are.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.